Okay, this is the Episodic Soap Note video presentation on Ganglion Cyst by Amber Boyd, Frontier Nursing University. The chief complaint from this patient is, I have a lump on my right wrist. It does not hurt. History and physical. HB is a 22-year-old Hispanic female presenting to this appointment with complaints of a lump in her right wrist that does not currently hurt. She noticed the lump about 6 weeks ago at the start of the semester, but because it was not painful and really small, she did not have it looked at. The lump has progressively gotten larger now that she has started playing softball again. She has tried putting ice on it to reduce the size, but this has not worked. She is starting to feel like it causes her wrist to be stiff when it gets really big after practice or a game. The lump will decrease in size after resting her arm. Her active medical problems. She's had asthma since 2006. It's classified as mild. It is also well controlled with medication. Her current medications are albuterol and MDI, which is 90 mics per puff. She takes 2 to 4 puffs PRN as needed. She also reports that she's only used this one time in the last 6 months. She also takes Tylenol 500 milligrams PRN for cramping with her menses, a multivitamin with folic acid once daily, and she also had a Mirena IUD placed in 2014. Her past medical history. She is allergic to penicillin, cats, and has seasonal allergies. She had a tonsillectomy in February of 2000. Her immunizations, she is up to date on her Tdap, which she had the booster in 2011. Her MMR, Hep B, and varicellas were administered as a child. She had influenza fall of 2015. Gynecological and obstetric history. Her last menstrual period, she's currently on her menses. Her cycle is regular. She also has that Mirena IUD in place, and she's a G0, P0. Her family history. Her mother and father are both alive and in good health. The father has a history of asthma that is also well controlled. Her maternal grandmother passed away from a cardiac event in 2007, but she does not know what that is. And then the patient has 2 siblings, ages 16 and 20. Both are in good health and have no illnesses. This patient's social history. She lives in the university dorms with her roommate. She plays college softball, is a pitcher, and currently enrolled in her junior year. She's been in a 1-year-long heterosexual monogamous relationship. She is sexually active and uses both contraceptives and male condoms. She does not smoke or use illicit drugs. She will drink socially 1 to 2 drinks at night on the weekends. Her parents and siblings are living in another state, and the patient has limited contact with them due to her busy schedule. Review of symptoms. The patient has no complaints of fever, chills, weakness, fatigue, or recent unexplained weight loss or gain. She has no rashes, sores, lesions, or changes to her skin or hair. She does note that there's a painless lump on her right wrist that has changed in size. Cardiovascular, no chest pain or discomfort, no edema, numbness, tingling, lightheadedness, dyspnea, or palpitations noted. Respiratory, no shortness of breath, cough, wheezing, or asthma exacerbations. Peripheral vascular, no leg cramps, varicose veins, or previous clots. No changes to color on her fingertips, radial and pedal pulses are 2+. Her musculoskeletal, no stiffness, joint pain, or arthritis to left upper extremity and bilateral lowers. She does have mild swelling and stiffness to the right wrist. No tenderness, redness, or history of trauma. On physical exam, this patient's vital signs are a temp of 98.2, her pulse is 76, her respiratory rate is 16, oxygen saturation is at 96% on room air, her blood pressure is 114/76, pain is rated at a 0 out of 10 on the verbal analog scale. She is 5'3" and a weight of 136 pounds. In general, this patient is alert and oriented to person, place, and time, She is well dressed and nourished. She appears to be of stated age and is in no acute distress. Her skin is dry, warm, and intact, and without erythema, redness, or rashes. She does have a 2 centimeter by 2 centimeter mass located on the dorsum of the wrist across the scapholinate interval, translucent upon illumination with a pen light. Respiratory, her lung sounds are cleared auscultation bilaterally. They are normal and symmetrical in expansion. Cardiovascular, she has S1 and S2 present. She has a normal, regular rate and rhythm. No murmur, gallop, or rub. Brisk cap refill on all 4 extremities, and no edema was noted. Musculoskeletal, she has no joint pain, full range of motion in the left wrist. Diagnosis. The diagnosis is a dorsal wrist ganglion cyst. The definition, ganglion cysts are the most frequent benign tumor located within the wrist and the hand. There are 2 different types on the dorsal side and the volar side. Etiology of ganglion cysts have been described as an outpouching of synovium fluid from a tear or degeneration of the joint. Approximately 50% of soft tissue tumors of the hand are ganglions, and those which present dorsally typically originate from the scapholinate ligament region, which can be seen right here. A ganglion cyst can also arise from the radioscaphoid or scaphotrapezial joint volarly. These locations can cause joint instability, weakness, and limitation of movement. They can also be on the ulnar side or on the radial side of the inner part of the wrist, as seen in this description right here. The pathophysiology is that ganglion cysts occur through degeneration and tearing of the joint capsule. This results in this outpouching of fluid from the joint. Size can definitely fluctuate depending on or in conjunction with activity level, and it has been described as like a one-way valve where fluid will come out and make the cyst expand, and with rest and relaxation, sometimes it can shrink as well. Risk factors. This may affect any individual in any age group, but tend to be more common in between ages 20 to 40. Another risk factor is utilizing repetitive motion. Some examples to be given with that are tennis, other sports, construction work, typing, and then again, a repetitive injury to that joint site. So whether there's a trauma and it's a repetitive trauma that's happening on a daily basis can cause these. So the assessment, this assessment is conducive of a dorsal wrist ganglion cyst. The ICD-10 code is M67.431, which is equivalent to a cyst, ganglion, and an unspecified wrist. The differential diagnosis for thought would be a lymphoma. The difference in symptomology with this would be a non-translucent with the illumination with the pen light, a giant cell tumor of the tendon sheath. Upon aspiration, you would not pull back a jelly-like substance. A foreign body granuloma will usually include an inflammatory response of infection in the area. And an epidermoid inclusion cyst often presents with a puncture or stab wound, sometimes even a laceration at that site. Management for this patient. Most management plans for ganglion cysts are to reassure and observe the ganglion cyst as long as it is not very painful and you think it's going to resolve spontaneously without treatment. It's really important to remember to consult or refer to a hand surgeon as soon as there is persistent or recurrent pain, a recurrent cyst, or a cosmetic deformity. Atypical features of major concern are a solid mass. You would want to consider referral to make sure that it's not malignant. Extreme pain, limitation of movement, and nerve palsies are indications for surgical resection. And it's just really important to remember that the nerve palsies can cause loss of function, and so that's definitely a point of a place where you would want to refer this patient. The follow-up and plan is reassurance and patient education, return for change in symptomology, and then continue treatment regimen for her asthma management. This is specific to this patient. Her ganglion cyst is on the dorsal side of the wrist. It is not altering her limitation of movement currently. She is also not in pain. So basically at this point, we would just want to reassure her and teach her that these are normal cysts. We want to watch it and make sure that it is either going away or will decrease. We'll also ask her to return for change if she has any changes in her symptoms, if her pain gets worse, if it gets larger, if she starts feeling tingling, numbness, or any sort of nerve palsy in that hand, or if she just feels like it's changing and she wants to get it looked at again. Medications, at this point in her treatment, a medication is not indicated. Occasionally, these ganglion cysts can be aspirated, and if they are aspirated, pain control is number one, and a steroid may also be indicated. However, studies are starting to show that with this treatment method, reoccurrence of these ganglion cysts is likely, so they're starting to stray away from it and trying to just go ahead with reassurance and patient education until it gets to the point where they need a surgical intervention. Diagnostic and tests or labs, there are no diagnostic tests or labs indicated for a benign ganglion cyst. However, you may want to order an ultrasound if you are having any type of nerve palsy, just to see if you can see where it's starting to interfere, or if you're suspecting a possible differential diagnosis. Again, no prescriptions are indicated for this patient at this time. In the event that pain control is needed, a prescription for an anti-inflammatory, such as ibuprofen, can be written. In this case, we could write a prescription for ibuprofen, 800 milligram tablet by mouth every 6 hours is needed for pain. Dispensing 60 would give her coverage for at least 2 weeks with an extra refill. I would definitely want to see this patient back if she were needing more pain control, specifically because she's saying it's not hurting at this time. This is my exam question. A 43-year-old male comes into the clinic complaining of a lump that has formed in his wrist. He has had this lump before and it went away, but over the weekend it has gotten worse after he was doing yard work. Upon assessment, you suspect the lump is a volar ganglion cyst and is located on the ulnar side of the wrist. He has limitation of his wrist movement and complains of extreme pain 9 out of 10. Which of the following symptoms is of most concern and requires immediate referral to a surgeon? Tingling and numbness in the distal part of the thumb, pain a 9 out of 10, reoccurrence of the ganglion cyst, or stiffness and decreased range of motion in the wrist. The answer is A. This indicates nerve involvement, nerve palsy, or compression, and will require immediate referral to a hand specialist and surgeon. This will need to be corrected promptly to prevent further damage. The rationales for the incorrect answers are as follows. These are my references. Thank you so much.